All right, when it comes to your health, who do you trust more? These guys or these guys? The White House is hoping singers like Adam Levine, dubbed the sexiest man alive, yes, he just beat me up by 1 vote, can sex up his health care law that is limping out of the gate and get young people to sign up. There's only one teeny-weeny problem. These guys, the guys in the white coats, all testifying on Capitol Hill today and laying out a very real problem with Obamacare that Hollywood types don't get.
Had patients who were healthy, previously not walking, et cetera, on a medication, doing great, who are crying in my office. People are really afraid, as you're seeing as well. They don't know whether their medication is going to be covered.
You know, clearly rationing care is something that has to be part of this to make it work. It is not the appropriate answer, however.
There will be a few winners, but ultimately the number of losers is going to be a lot greater.
All right, to Dr. Ben Carson, who, you know, eerily and presciently saw all of this rolling out just the way it's rolling out. How does it continue to roll out, Doctor? What do you think?
Well, you know, it's kind of sad that, that some people think that the American people are so simplistic that you can take an actor, somebody who sings, and trot them out there, and they say this is good, and that they'll say, oh, wonderful, he said it was good. I don't think they're quite that simplistic. I really don't. And I think they're probably more likely to be starting to look under the covers now and see what is actually going on. You know, as I've said before, you know, we're only seeing the very surface. As we get into the layers of this thing, it becomes increasingly more complex. And way more complex than it needs to be, with a whole lot more small print. And, you know, I know that there are some who have said, you should have read the small print, because the small print says you cannot reasonably expect confidentiality of your records. Well, you know, people are telling us this. They didn't even read the big print, and they want you to read the small print, you know, before they passed it.
Yeah, and by the way, yeah, you're right. They themselves didn't read the big print. You know, Doctor, just as we're talking here, we're getting word now that they might be trying to update this to help some folks out who are going to miss a deadline, that individuals unable to enroll by December 23rd because of marketplace errors, that sort of thing that you've cited, will be able to qualify for special enrollment and gain coverage as soon as possible, the administration says. Also saying that it could postpone that December 23rd enrollment deadline for obtaining January health coverage under exceptional circumstances, without detailing what those circumstances are. But obviously, yet another rejiggering.
Yeah, and as I've said before, why not just postpone it forever? And why don't we sit down like intelligent human beings, work together, and decide on something that works? You know, I agree that everybody should have health care, but I think it's more of a responsibility than it is a right. Having said that, we do have a responsibility to everyone in our society, and we're smart enough to figure out how to do this. We already spend twice as much per capita as the next closest nation, and look what a mess we have. That means with some logical, sensical, common sense solutions, we can solve this problem.
You know, Doctor, I was listening to some of the doctors on the Hill today, and a few of them were making references to new drugs and treatments for handling conditions that once looked hopeless. And that under Obamacare, depending on the malady, you might not be covered. In fact, you could be cut midstream from such treatments. Is that true?
Absolutely, it's true. And it's true that in terms of the drugs that really work well, that come out, the vast majority of them come from us. The various types of surgical innovations, the vast majority of them come from us. You know, I was in a country that has socialized medicine, giving lectures a few years ago, and the doctors came up to me afterwards and said, great lecture, but it looks like you guys are moving toward us in terms of socialized medicine, and we should be gloating because the great United States is coming our way. But we're not, because if you guys become like us, who's going to make the innovations? What's going to happen to us in medicine? They were really quite concerned.
Wow, that's interesting, because we are. They were right on that mess, but we are moving their way, not the other way. Doctor, it's always a pleasure. Have a Merry Christmas if I don't talk to you again.
Thank you, Neil. Merry Christmas to you.
Ben Carson. All right.